Hi, my name is Ashley Annip and I will be discussing renal disease. First off, I'm going to start with the functions of the kidneys. The human body has two bean-like shaped organs about the size of a fist known as the kidneys. The kidneys play an important function in the process of cleaning out waste products from the human body. They are able to remove waste from the blood, balance body fluids, and create urine for removal. They can also regulate the composition volume of blood, remove metabolic waste in the urine, and control acid and base balances in the body. It is important for the kidneys to be healthy and to be able to process daily activities because they have an important role in the body's physiological functions. It is possible for someone to live with only one kidney, but once both begin to fail, it becomes challenging for the body to continue its normal biological activity. There can be acute kidney disease and chronic kidney disease. Acute kidney injuries are characterized by sudden and temporary loss of kidney function, while chronic kidney disease is any condition that causes reduced kidney function. Chronic kidney disease can be described in 5 stages. In the first stage, the kidney appears to be damaged, but there is still normal function. There is also persistent proteinuria, which is a condition where there are more than normal amounts of albumin in the urine. Albumin is a very important type of protein that is circulating around the body. It keeps fluids from leaking out of the blood vessels, nourishes tissues, and transports hormones, vitamins, and drugs throughout the body. Even though this is a very important protein, too much of it can have serious effects on the kidneys. In stage 2, there is kidney damage with mild loss of kidney function. Kidney function is measured by glomerular filtration rate, also known as GFR. This is the rate the kidneys filter waste and extra fluids from the body. While in stage 1, GFR is predicted to be greater than 90 milliliters per minute, and in stage 2, GFR is said to be between 60 and 89 milliliters per minute. In stage 3, there is mild to severe loss of kidney function, and the GFR is estimated to be at 30 to 59 milliliters per minute. As more damage is done to the kidneys, function begins to decline more rapidly. The two organs are not able to filter out waste products out of the blood. In stage 4, there is severe loss of kidney function, and the GFR is between 15 and 29 milliliters per minute. And finally, in the last stage, stage 5, complete kidney failure will occur and will require dialysis or a kidney transplant for survival. This stage is commonly referred to as the end-stage renal disease. There are a few ways that renal disease can be treated. First off, it can be treated in earlier stages by treating the symptoms. Medications to lower blood pressure, lower cholesterol levels, treat anemia, relieve swelling, and protect the bones can all be beneficial. Next, there are 2 types of dialysis, peritoneal dialysis and hemodialysis. In peritoneal dialysis, the lining of the own stomach acts as a natural filter. Wastes are taken out through the process of dialysate. Dialysate occurs through cycles in a person's stomach. A catheter is placed in the stomach and a sterile cleansing fluid is inserted into the catheter. After filtration, the fluid leaves the body, cleansing out any toxins in the body. Hemodialysis uses a machine in which it filters the patient's blood outside of their body. A pump on hemodialysis machine draws blood through one of the needles into a tube. In the tube, there are thin fibers that filter out waste, extra salts, and extra fluids. This machine essentially replaces the kidneys. Kidney transplants are another option for individuals suffering from the end-stage renal disease. Patients who are contended for kidney transplants are usually on a waiting list for a while until a perfect match is available. Until there is a perfect match, their option would be to continue with dialysis. Nutritional therapy may help manage uremia, electrolytes, and acid-base imbalances, and water and salt retention. The National Kidney Disease Education Program was set up to help patients with this disease. They provide nutritional resources as well as handouts to allow knowledge to be accessed easily. Nutritionally, sodium intake should be limited to 2,300 milligrams or less per day. Sodium plays a large role in blood pressure control, which can lead to altercations in sodium excretion by the kidneys. Patients with kidney failure should limit the amount of dietary protein they consume. Non-diabetic patients should consume 0.8 grams of protein per kilogram per day, and diabetics can consume 0.8 to 1.0 grams per kilogram per day. In conclusion, renal disease may have severe effects on the body's physiological functions. The kidneys play a vital role in how the body balances electrolytes, acid-base substances, and water within the body. With immediate care and treatment, a person can live with limited kidney function if appropriate steps are taken.